What if I told you that every blood pressure reading you've taken in the last year is wrong? Not slightly wrong, not kind of wrong, but completely wrong. And based on that wrong information, you or your doctor might be making decisions about medications, dosage changes, and lifestyle adjustments that you shouldn't be making at all. I'm Dr. Emily Richardson, and I've spent 23 years watching patients sabotage their own health with a device that's sitting in their bathroom right now. The thing is, most people think they're measuring their blood pressure correctly. They follow the instructions. They sit down, wrap the cuff around their arm, press the button, and read the numbers. But here's what keeps me up at night. There are at least 10 critical mistakes that the vast majority of people make every single time they check their blood pressure. And these aren't minor errors. These are mistakes that can throw off your reading by 20, 30, even 40 points. That could mean the difference between being told your blood pressure is healthy or being told you need medication. That could mean the difference between your doctor adjusting your prescription or leaving it exactly where it is. And in some cases, those wrong numbers could lead to life-threatening decisions. By the end of this video, you're going to know exactly what those 10 mistakes are. You're going to understand why each one matters, and most importantly, you're going to know exactly how to measure your blood pressure the right way. But before we dive in, I need to share something that happened to one of my patients last month because it perfectly illustrates why this matters so much. Let me tell you about Harold. Harold is 67 years old, a retired engineer, very detail-oriented, someone who I would have trusted to measure his blood pressure correctly. And he was measuring it correctly, or so he thought. He'd been checking his numbers every morning and evening for 3 months. His readings were consistently around 158/96, and based on those numbers, his doctor had started him on blood pressure medication. Then he came to see me for a second opinion, and something didn't add up. His in-office readings were significantly lower, around 138/85. Not normal, but much better than what he was reporting from home. And that discrepancy bothered me. So I asked Harold to show me exactly how he was taking his measurements at home. I made him demonstrate the whole process in my office. And what I saw was shocking. Harold was making not 1, not 2, but 5 of the 10 mistakes I'm about to show you. His numbers were artificially inflated by at least 20 points on the top number and 10 points on the bottom number. Based on those wrong readings, he'd been put on medication he probably didn't need at that dose. His doctor had made a treatment decision based on inaccurate information, and this happens constantly. This happens in doctors' offices, in pharmacies, in homes across America every single day. So let's go through these 10 mistakes one by one. I'm going to start with mistake number 10 and build up to the most critical ones. By the time we're done, you're going to have the knowledge to measure your blood pressure with clinical precision in your own bathroom. Mistake number 10 seems so trivial that most people don't even think about it, but it can absolutely destroy the accuracy of your reading. You're checking your blood pressure with a full bladder. I know, this sounds ridiculous. How could having to pee affect your blood pressure? But the physiology here is actually pretty straightforward. When your bladder is full, it puts pressure on your abdomen and your major blood vessels. That pressure triggers a sympathetic nervous system response. Your body thinks it's under some kind of stress, even if you're sitting perfectly still. That stress response causes your heart rate to increase and your blood vessels to constrict slightly, raising your blood pressure by anywhere from 5 to 15 points. I've seen this happen in my own patients. I had a woman who consistently recorded readings in the 150s/90s at home. When she came to see me, her in-office reading was 135/85, which was still elevated but a significant difference. I asked her to use the bathroom and come back for a repeat reading. Her blood pressure dropped to 128/80. That 12-point difference in systolic pressure was entirely because of her full bladder. The simple fix is this: always use the bathroom before measuring your blood pressure. Give yourself at least 5 to 10 minutes after emptying your bladder before you sit down to take a reading. Let your body settle, let your nervous system calm down, and then measure. Mistake number 9 is one that I see constantly, especially in older patients who are trying to be thorough about their health. You've just walked across the room, maybe from the kitchen or the bedroom, and you sit right down and check your blood pressure. Or worse, you just climbed a flight of stairs, caught your breath, and measured. Here's what happens when you exercise, even mildly. Your heart rate increases. Your cardiac output increases. Your blood vessels dilate in your muscles to bring more blood to where it's needed. Your blood pressure rises temporarily. This is normal. This is how your body responds to physical activity. But when you measure your blood pressure immediately after this, you're not getting your resting blood pressure. You're getting your post-activity blood pressure, which can be significantly higher. A study in the American Journal of Hypertension found that systolic blood pressure can remain elevated for up to 20 minutes after moderate physical activity. So if you climb stairs, walk briskly, or even just move around a lot, you need to rest before you measure. The guideline is simple. Sit quietly for at least 5 minutes before taking your reading, and if you've done something particularly strenuous, give yourself 15 to 20 minutes to fully recover. Mistake number 8 is something that almost no one considers, but it has a surprisingly large impact on your readings. You've just eaten a meal. Maybe you had a big breakfast, or you grabbed lunch and decided to check your blood pressure afterward. That food you just ate is still being digested, and your body is redirecting blood flow to your stomach and intestines to support that digestive process. This is called the postprandial effect, and it can elevate your blood pressure by 5 to 10 points, sometimes even more. The research here is pretty clear. Blood pressure tends to be highest after meals and lowest in the early morning before eating. I had a patient who was measuring his blood pressure every day right after breakfast. His readings were consistently in the 155/95 range, and his doctor kept increasing his medication. Then he mentioned this to his cardiologist, who suggested he check his blood pressure before eating instead of after. The difference was remarkable. His fasting morning readings were consistently 10 to 12 points lower than his post-breakfast readings. He ended up being on too high a dose of medication because his measurements were artificially elevated by his breakfast routine. The recommendation is straightforward. Don't measure your blood pressure within 30 minutes of eating a meal. If you want to measure in the morning, do it before breakfast or at least an hour after you've eaten. If you want to measure in the evening, avoid checking within 30 minutes of dinner. Mistake number 7 brings us to something that many people do without even thinking about it, and I see this all the time in my practice. You're sitting there measuring your blood pressure, and your legs are crossed. Or maybe your feet are dangling because you're sitting on an exam table. These seemingly minor postural issues can actually significantly affect your reading. When you cross your legs, you compress the blood vessels in your thighs and lower abdomen. This increases resistance in your circulatory system and can raise your systolic blood pressure by anywhere from 5 to 20 points. The higher your blood pressure already is, the more significant this effect can be. I've actually had patients demonstrate this in my office. We measured their blood pressure with legs uncrossed, then crossed their legs and re-measured. In some cases, the difference was shocking. One patient's systolic pressure went from 138 to 158 just from crossing his legs. Similarly, if your feet aren't flat on the floor, if they're dangling or propped up on a footrest, you're not in the optimal position for an accurate reading. Your feet should be flat on the floor or on a stable footstool, with your back supported and your legs uncrossed. This might seem like a small thing, but it matters. Mistake number 6 is one that surprises a lot of people because it seems completely unrelated to blood pressure. You've been talking on the phone or chatting with your spouse, and you decide to check your blood pressure while you're mid-conversation. Or maybe you're watching television while you measure, thinking that being entertained isn't really affecting anything. But it is. Talking, listening, processing information, even watching emotionally engaging content, all of these activities stimulate your brain and activate your sympathetic nervous system. Your heart rate and blood pressure respond to this stimulation. Research has consistently shown that blood pressure readings taken during conversation or while watching TV are higher than readings taken in complete silence. The effect is more pronounced with emotionally charged content, but even casual conversation can add 5 to 10 points to your systolic reading. The American Heart Association specifically recommends that you sit quietly without talking or distractions for 3 to 5 minutes before and during your blood pressure measurement. This means no phone calls, no conversations with family members, no television, no reading, nothing. Just quiet sitting in a calm state. Mistake number 5 is one that a lot of people don't even realize they're doing. You're at a pharmacy or a grocery store and you use one of those automatic blood pressure machines they have near the pharmacy counter. Those machines are convenient, right? Quick, easy, no appointment needed. But here's the problem with those machines. They weren't calibrated for your body. The cuff size that works for one person doesn't work for everyone. If the cuff is too small for your arm, it will give you artificially high readings. If it's too large, it might give you readings that are slightly lower than your actual blood pressure. But the too small cuff problem is much more common and much more significant. Using a cuff that's too small can overestimate your systolic blood pressure by 10 to 40 points. That's not a small error. I can't tell you how many patients have come to me convinced their blood pressure was dangerously high because a pharmacy machine told them it was. And when we measured with a properly sized cuff in the office, their numbers were completely normal. The solution is to know your arm circumference and use a cuff that's appropriate for your size. If you're not sure what size cuff you need, measure around your upper arm at the midpoint and use that measurement to choose the right cuff. Standard cuffs typically fit arms between 9 and 13 inches in circumference. Large cuffs work for arms 13 to 17 inches. Extra large for anything larger. And please, don't use those pharmacy machines as your primary method of monitoring. They're fine for occasional checks, but they're not reliable enough for ongoing management. Mistake number 4 is something that happens all the time, and it's one of the most commonly overlooked aspects of proper blood pressure measurement. You're sitting there with the cuff wrapped around your arm, but it's placed over your sleeve. Or it's wrapped too loosely. Or it's placed on the wrong part of your arm. The position and placement of the cuff matters enormously. If the cuff is over a thick sleeve, the fabric can interfere with the sensor and give you inaccurate readings. If it's wrapped too loosely, it won't compress your artery properly. If it's placed too high or too low on your arm, it won't align properly with your brachial artery, which is the main artery that runs along the inside of your upper arm. The correct placement is on your bare upper arm, about 1 inch above the bend of your elbow. The cuff should be snug but not tight. You should be able to fit 2 fingers between the cuff and your arm. The tube from the cuff should run down the inside of your arm, pointing toward your hand. And here's something most people don't know. The bottom of the cuff should be about 1 inch above your elbow crease, not right at the crease. This positioning ensures that the bladder inside the cuff, the part that actually inflates, is directly over your brachial artery. I always show my patients exactly where to place the cuff because it's one of those details that makes a massive difference. Mistake number 3 brings us to something that absolutely blows people's minds when I explain it. You're supposed to support your arm while measuring your blood pressure. Most people don't realize this, and they hold their arm in the wrong position, which significantly affects the reading. If your arm is hanging down at your side, gravity is working on your blood, and your heart has to work harder to pump blood up to where the cuff is. This elevates your reading. If your arm is raised up, the same issue applies in reverse. The correct position is to have your arm supported at heart level, meaning your arm is resting on a surface like a table or desk, and your elbow is at roughly the same height as your heart. When your arm is properly supported, your heart doesn't have to fight gravity to get blood to the cuff. The reading is more accurate. Research has shown that unsupported arms can add 10 or more points to your systolic blood pressure reading. And the direction of support matters too. Your arm should be resting comfortably, not tense or holding itself up. Your hand should be relaxed, not gripping something or making a fist. If you're using an automatic monitor at home, make sure your arm is resting on a table or desk with the cuff positioned correctly. This is one of those small details that most people skip, but it makes a huge difference. Mistake number 2 is something that even some healthcare professionals get wrong, and it's the timing of the reading itself. Most people measure their blood pressure once, see the number, and consider it done. But one reading is not enough. Your blood pressure fluctuates constantly throughout the day. It changes based on time of day, stress levels, what you've eaten, what you've done, all kinds of factors. A single reading is just a snapshot, a single moment in time. It doesn't tell you what your blood pressure is generally like. The American Heart Association recommends taking at least 2 readings, 1 minute apart, and averaging them. And ideally, you want to measure at different times of day, on different days, to get a complete picture. What I tell my patients is to take their blood pressure in the morning before eating or drinking anything, and again in the evening before dinner. Do this for 3 to 7 days and write down all the readings. Then bring that log to your doctor. That gives you and your doctor a much more accurate picture of what your blood pressure is really doing. One high reading doesn't mean you have hypertension. One low reading doesn't mean you're fine. It's the pattern that matters. And if you get a reading that's dramatically different from your usual pattern, wait a few minutes and check again before you panic or celebrate. Don't make any medication changes based on a single reading, ever. And now we've arrived at mistake number 1, and this is the big one. This is the mistake that I see more than any other, and it's probably the most impactful on the accuracy of your blood pressure measurements. You're not resting long enough before you measure. This is it. This is the king of all blood pressure measurement mistakes. Most people sit down, wrap the cuff on, and press the button. They might give themselves 30 seconds, maybe a full minute if they're being careful. But here's what the American Heart Association and every major cardiology organization recommends. You need to sit quietly for at least 5 minutes before taking your blood pressure reading, not 30 seconds, not 1 minute. 5 full minutes. And during those 5 minutes, you need to be in a calm, quiet environment. No talking, no distractions, no stimulation, just sitting. Why does this matter so much? Because your blood pressure responds to activity and stress. If you've been moving around, if you've been anxious, if you've been in an emotionally charged conversation, if you've just experienced any kind of physical or mental activity, your blood pressure is elevated above your resting level. You need time for it to come back down to baseline. I've had patients who would come into my office stressed about traffic, stressed about the appointment itself, stressed about their health. And if we measured their blood pressure immediately upon arrival, their readings would be sky high, like 170 over 100, sometimes even higher. Then we'd have them sit quietly for 5 or 10 minutes, and I'd measure again. Their blood pressure would drop by 20, 30, sometimes 40 points, just from rest. The funny thing is, these patients weren't necessarily more stressed than normal. They were just experiencing normal life stress, and that stress was artificially elevating their readings. So here's exactly what you need to do. Find a quiet place. Sit in a chair with your back supported, rest your feet flat on the floor, rest your arm on a surface at heart level. Close your eyes if that helps you relax. Breathe slowly and deeply. Don't think about anything stressful. Just breathe and relax. Do this for 5 full minutes. Then take your reading. Don't check your phone. Don't have a conversation. Don't think about your to-do list. Just be still and calm. All right, Now let me put all of this together into a complete, proper blood pressure measurement routine that you can follow starting today. First, make sure you have the right equipment. Get a validated blood pressure monitor, one that's been tested for accuracy. Make sure you have the right cuff size for your arm. Check your monitor's accuracy periodically by comparing it to readings at your doctor's office. Second, avoid all the pitfalls we just discussed. Don't measure with a full bladder. Don't measure right after eating, exercising, or any physical activity. Don't cross your legs or have your feet dangling. Don't talk or watch TV during the measurement. Don't use a too small cuff. Make sure the cuff is positioned correctly on bare skin. Make sure your arm is supported at heart level. Third, give yourself 5 full minutes of quiet rest before you take the reading. I know this seems like a long time, but it's absolutely critical for an accurate reading. Fourth, take at least 2 readings, 1 minute apart, and average them. Record all your readings with the date and time. Fifth, measure at consistent times each day, ideally morning and evening, before eating or drinking anything in the morning and before dinner in the evening. Do this for at least 3 to 7 days and share those results with your doctor. That's it. That's the complete protocol. It's simple, but each step matters. Now I want to tell you about one more patient, and then I'm going to ask you to do something important. Her name was Beverly, 73 years old, retired teacher, and she was one of the most diligent patients I've ever had. She was measuring her blood pressure twice daily, writing everything down, bringing her log to every appointment. But her numbers were always concerning, always elevated. Her doctor had been talking about adding another medication. Then I sat down with Beverly and went through her measurement technique with her, step by step. And I discovered that she was making several of the mistakes we've talked about today. She was measuring right after getting out of bed, before resting. She was crossing her legs while sitting. She was wearing her cuff over a thick sweater, and she wasn't resting long enough. We fixed all of that. We got her a proper 5-minute rest period. We corrected her posture. We positioned the cuff correctly. And her blood pressure readings dropped by an average of 15 points systolic within 2 weeks. Her doctor didn't need to add a new medication after all. Beverly told me later that she felt like she had her life back. She wasn't worried anymore about being on multiple medications. She wasn't scared that her blood pressure was out of control. She just needed to learn how to measure correctly. And that's what I want for you. If this video has been helpful, if you're learning things that could protect your health, I need you to do 3 things. First, subscribe to this channel. I'm Dr. Emily Richardson, and I'm committed to bringing you the health information that your doctor might not have time to tell you. Second, share this video with anyone you know who checks their blood pressure at home. This information could prevent them from being put on unnecessary medications or help them get the correct treatment they actually need. Third, leave a comment below. Tell me, which of these 10 mistakes have you been making? Or tell me about your experience with home blood pressure monitoring. I read every comment, and I love hearing from you. Your blood pressure is one of the most important numbers in your health. Measure it correctly, take control of your health, and I'll see you in the next video.